Hello and welcome to this session. My name is Tara and I'm one of the trainers here at Exon Health. Today I'm just going to spend about 30 minutes talking you through the new features of Surgery Connect. I'll be doing some live demos just to show you how easy they are to use. A bit of housekeeping first. The call is being recorded today for sharing purposes, and also if you've got any questions, please do drop them in the Q&A box. My colleague Dee is sat in on the webinar as well, so she will endeavour to answer the questions. And at certain points throughout the webinar, there will be additional information that Dee will pop into the chat box, but I'll be telling you as we go through. Okay, so let's get started. So these additional features that we're going to cover today are designed to reduce phone fatigue for your reception teams, whilst also giving patients more autonomy and transparency. Now, whether it's helping to eliminate the morning rush on the phones or saving hours of admin time each week, these tools are ready for you to use right now. So what are we going to cover today? First of all, website widgets. Now, currently, patients are unaware of the morning rush right up until they call in, and this can lead to frustration. So moving forwards, we have got customizable web pages that will display live queue status on the surgery website. So it's therefore setting realistic expectations before the patient even picks up the phone. Then we've got voicemail transcription. So currently your admin staff are probably listening to long, maybe rambling voicemails, and it's taking up a substantial amount of their time. Moving forwards, staff can now read the transcript at a glance of the voicemail, and they can identify urgent needs instantly. They can copy text directly, and they can manage high volume lines like repeat prescriptions without having to sit through minutes of audio. Then we've got the additional queue position web pages. So currently there's just a generic callback page that doesn't provide specific information that a patient needs for their unique call. Now, moving forward, we now offer multiple group specific web pages. So if a patient requests a callback from a specific department, the URL and the content they see are tailored to that choice. So it's ensuring the information is always relevant to their journey. And then we've got the silent monitoring. So currently, standard users lack an accessible way to initiate silent monitoring support without undergoing a formal supervisor escalation process. Now, moving forward, we've introduced an invitation-based silent monitoring directly in the phone bar. This enables a seamless peer observation and supervisor listen-in capabilities. Now, lastly, as you can see at the bottom of the screen here, we do have, hopefully by the end of May, we're going to have released the enhanced reporting features to Surgery Connect customers. And these will sit in the reports console, and they'll bring you much more to the reports, so allowing you to analyse the data and make more informed decisions. So let's move on to the website widgets. Now, website widgets are customizable digital web pages that display live queue status on the practice website, and they can serve as a digital window, and it can allow patients to see exactly how busy the surgery is in real time. Now, practices can choose to display the total callers in the queue, which is here, and then or they can choose to display the current longest wait time, which is here. So those are the live data points. Now, widgets can also be filtered to show data for specific departments. So, for example, appointments, prescriptions, etc. So that's being targeted visibility. And then widgets are fully customizable to match your existing branding, your digital presence in your website. So that's the seamless integration. So What we're going to do now is I'm going to show you a demo of how to access it and set up a website widget. Okay, so first of all, we need to head over to the service delivery console. Okay, we need to then click on Advanced, scroll down, and you'll see Website Widgets. Click on Manage Queue Widgets. And here we've already got two that have been created. So you've got the widget name, last edited, the date, and who edited it. If you wanted to go in and edit, you'd click on the blue pencil. If you wanted to delete, click on the red cross. So I'm just going to click and create a new queue widget. So here we would enter the name of the widget, maybe specific to a group. And this is where you will fully customize your widget. So here's the output. This is where you can select the callers in the queue or the current longest wait. Then you can select your group. So you can either select all groups to display, or you can select one of the following that's in this drop-down list. You can only select one group or all of the groups. Okay. Then what we have is, I'm just going to type in something here. Then what we have is the customization that can match your website. So here we've got the text. So we've got the font color. We can change to a blue, and I'll click that so you can see the text has changed. We can also change the font size. Okay, and then the icon, so that's the icon there. We can change the color again, click a similar color, and we can change the size. Then also we can choose a shadow or border for the frame. So I'm going to choose the shadow, you can see, and the border. And I can choose a similar color for the border. So you can see all of that is done, and it gives you an automatic preview there. Once you're ready, you click on Generate Code. As soon as you've clicked on Generate Code, it will save the widget for you. Okay, and there's the code. So what happens then is, once you've got your code, if, for example, your website is managed by an external company, you'd give that code to that company. Or if you manage it in-house, you can copy and paste that code directly into your web page. And it's as easy as that. You can create as many widgets as you like and have them at strategic places within your website. So if we go back, we do have a little bit of guidance for you. So if we just look here, now what we do say is visibility equals value. So just make sure that the widgets are accessible and visible. They're not hidden under lots of menus. The widget only works if a patient sees it before they feel, before they are wanting to make a phone call, so it can quash that frustration. So key guidance points. Prioritize that accessibility. So usually the widget should be front and center. Place it in a prominent location where the patient's eyes naturally land when seeking help. And then having it on the home page is essential. At least one widget must live on the primary home page. And as I said earlier, if a patient's got to hunt through submenus to find a queue length, then the opportunity to manage their expectations is already lost. Then we've got guidance on positioning. So if you place it near a contact us button or request an appointment links, then it ensures the patient is seeing the live wait time or the queue length exactly at the moment they are deciding whether to call or use an online alternative. And then lastly, making sure it's customized so that the data is readable for all users, and it's supporting the practice's overall accessibility standards. Okay. So the call queue widgets in Surgery Assist. So Surgery Assist is our digital assistant bot, and you can add in the call queue widgets. So it's with the same functionality as the website widgets, and it can be implemented within your practices in the digital assistant interface. So the widget basically manages the patient expectations as before, providing the telephony visibility within the digital chat stream. And it helps them decide whether to remain on the phone or proceed with an alternative digital option, very similar to the website widgets. So configuring and embedding, the same as before with the website widgets. The call queue widgets are created and designed within the service delivery console, and then you copy the generated code. The copied URL can be pasted into Surgery Assist portal, into the settings, and then if any changes are made in the service delivery console, it will automatically update it in Surgery Assist, the digital assistant. Okay, so we do have additional resources. Dee, my colleague, will add these into the chat box. We've got the Help Centre guides for Surgery Connect and Surgery Assist. We've got a case study from the Bay Medical Practice, and we've also got Academy modules that are CPD accredited on the call queue and transparency for patients. Okay, so those will be popped into the chat. Okay, let's go on to voicemail transcription. So this is for personal and group voicemails. So following on from the introduction of voicemails to the communications window, we have added a transcription feature. Now this allows users to check the content of a voicemail without having to listen to the whole message. And you can easily copy the content of the message to the clipboard. The advanced speech recognition converts the spoken words into written text, and it's displayed directly in your communications window. So this feature basically revolutionizes how you manage your messages. You can quickly scan the transcripts, staff can prioritize urgent requests, identify key information, and save the time previously spent listening to voicemails, entire voicemails. So what we're going to do is now have a look at a demo, and I'll show you it for real. So I've got my phone bar here. I'm just going to click to expand it. You can see I've got my communications window icon here. So I'm just going to click the icon. I've also got the orange dot, and it's got a number 1 in it. So this is notifying me that I have got a notification. I've got the orange dot here. It's a voicemail. And I've got a number 1 orange, number 1 in the group. So here is the voicemail. If I just click, it will highlight it in blue, and it will present all of the information. So we've got the call information, the number. You can actually click and call the number back as well. It tells you the group that the voicemail has come through to and the date and time. You can listen to the voicemail here, but you have the voicemail transcription here. Okay, so once you have dealt with that, you can either delete the voicemail or you can save it. And if you look here, we've got the bookmark, and that indicates that this particular one and this one have been saved. Okay, the phone bar does have a limit of 1,000 items within the voicemail tab, so it does accommodate quite a lot of voicemails. Okay, so again, we have got additional resources to help you. We've got the Help Centre guides on the full voicemail feature and the transcription area. We've got a case study also from Alexander House Surgery. And again, we have got the Academy modules CPD certified with getting started with the phone bar. Okay. So now what I'm going to do is walk you through the patient callback queue position web page. Okay. So currently when a patient requests a callback from a practice, they get a free of charge SMS, and it's sent to the patient with a link taking them to a generic web page. So this web page confirms the callback and also shows the caller moving up the queue. Now it prepares the patient for when to expect a callback from the surgery. Now, what we've introduced is the ability to configure multiple queue position web pages across a service, which means that web pages can now be tailored for individual groups. And then for services that have got multiple sites, it also means that the link to these web pages can be tailored to a specific site. So this has meant that all groups using the queue position feature previously only had one page available. Now the information displayed on the queue position web page is tailored to the specific group and the callback that it was booked for. So this enhancement allows for the display of more relevant information for patients, and tailoring the queue position web page for the group that the callback was booked for. The feature also contributes to increasing the efficiency of the call flow and helps to utilise other Surgery Connect features, and the services with multiple practices, as I mentioned before, can now create their own web pages with site-specific information. So it increases the relevance of the information provided to their patients. So now I'm just going to show you a quick demo of where it is and how to create one. So first of all, again, we need to go through to the service delivery console. So here we are. We're going to click on Advanced and scroll down and go to Patient Callback. Here we click on Manage Patient Callback, and you can see we have we've got the default one, and we've got a couple that have been created. Again, click to edit, click to delete, and we've got the last edited and who by. So click Create New Web Page. And the web page name at the top, this is for internal purposes only, so the patient doesn't see this. The surgery name, the patient does see it. It's got a maximum of 60 characters. Then we've got the title, and then we have the content. So you can add in text and you can add in a link as well. You've got a maximum of 2,000 characters in here, so you can fit quite a bit of information in there. You can also preview it when you've finished adding the content, and then you click on Save. Okay, I'm just going to cancel out of that, and I'm going to show you one that was prepared earlier. There we go. Okay, and also I'm just going to preview the default web page. So that is what it looks like to patients. So there you've got that would be your surgery, you've got your queue position, and then if you had any links, or your message would be down here. Okay. So it's really easy. Then once you have created your web page, you would add it into the group where you have got patient callback activated. So you would add the specific web page into there. Okay. So again, it's really easy, and we also have additional resources for you. So again, we've got help centre guides for patient callback. We have got a case study as well for you to look at with the From Medical Practice, and also we have the Academy modules that are CPD accredited for optimising patient callback. Okay. So now we're going to look, and this is going to improve the quality with easier silent monitoring. So I'm going to show you how to access this feature directly from the phone bar, making it simpler than ever to support staff training and maintain those quality standards. So the silent monitoring feature has been added as a new in-call feature, and it's part of the 8.6.5 version release of the phone bar. It allows an additional user to listen in or join an active call via the phone bar. So by invitation or by listening in, and that's where a supervisor can silently monitor an active call without notifying either participant on the call. So this can be used for training, medical students listening to calls, and additional input when required, or even just to listen to known difficult callers. So what I'm going to do now is show you this feature. I'm going to demonstrate it. My colleague Dee is going to work with me on this, and we'll demonstrate it together. So what I'm going to do first, expand my phone bar, and I'm going to add in a number, and we're just going to connect to that caller. It's connecting. So we have the caller on the phone, and immediately it's becoming quite difficult, the call. So you can see we have the icon here, and this is the silent monitoring icon. So if I click on here, you can see it looks very much like the contacts directory. But it says invite colleague. Now, I can see my colleague Joe Grant is available. So all I need to do is just click on the headset icon, and I can invite Joe to silently monitor this call. So if I just click there and send the invite, Joe will receive an invite on her phone bar. As soon as she has joined, you can see the icon has gone orange. Okay. So she's joined. Now, at the moment, Jo can listen in, and also she can speak to myself or the caller without each other knowing, or speak to us both. Okay, I'm going to show you from the other side so you can have a visual as well. Okay, so once Jo ends the call on her side, it ends her call. It doesn't end the original call. So you can see the silent monitoring icon has gone back to white. That means she's come off the call, but I'm still talking to the original caller. And now I'm going to hang up. Okay. So now we are going to show you what it looks like when we are invited to monitor our call. So Jo should be get an invite pop up. Okay. Okay, so we are now monitoring the call. You can see we've got the silent monitoring. If I click on here, you can see I've got the agent, which is the user, and then the caller. And I can, both of them by default are on mute. If I click, I can speak to the caller, or I can speak to the agent, or both at the same time. Okay, so these are both mute. And this is being invited. So I'm going to end that call. And if I wanted to silently monitor a call, I would go into the contacts directory. You can see Joe is on a call, and there's a headset there. So I'm going to start that monitoring call. And again, I'm monitoring the call, but Joe doesn't know I'm monitoring. It's a silent monitor. Okay. So there's two ways to do that. There is an invite where we get the invite on the phone bar, or you can select, go into the contacts directory and select a call that they're already on. Okay. So for training purposes, that is invaluable. And just for observations as well. Now, we do have additional resources, as always. With regards to the Help Centre, we've got an article on the silent monitoring, and we've also got the Academy module that's CPD accredited, and on the silent monitoring on the phone bar course. So I'm just going to move that out of the way. Then the last thing I'm just going to look at is the enhanced reporting. I'm just going to touch on it because we do have a reporting webinar, enhanced reporting webinar coming soon in June. This is using the Power BI reporting, and it's being released in stages, so watch out for the release notes. And we hope to have this up and running by the end of May. So with regards to the telephony, we are introducing new telephony reports by using the Power BI and BigQuery. This release will include a refresh of all reports and dashboards, as well as some enhancements to the data. This will also mean reports will all be in one place for Surgery Connect customers. And moving to Power BI has enabled us to make changes automatically without having to refresh the links each time. So it's saving a lot of admin work and making it easier for the customers to access their reports. So the internal benefits of these enhanced reporting, it basically means that all the reports are in one place. So reports for Surgery Connect, reports for that include Surgery Insights, Surgery Intellect, OmniConsult, Surgery Assist, and any other new features will all be in one place now. There's also going to be standard definitions. So each report will use the same terminology, and it eliminates the confusion between the reports. Surgery Connect reports are going to be refreshed. They'll have a changed layout, and they'll incorporate the new product feature requests. And also it will change and free up reporting work from the development team so that they can focus on our other products and speed up the delivery of changes. Okay. So again, the benefits to our customers. Tables, the data tables are now paired with dynamic bars and line graphs. It also can provide more granular view on how staff are managing their time. SMS reporting has shifted to segment tracking rather than messages, so you can accurately view the costings, and also you've got long-term benchmarkings, so it enables 12-month rolling view of performance. So practices can visualize long-term strategies and report growth. So Surgery Intellect report is available now. It can pinpoint users who are adopting Intellect and those who aren't. It can also estimate the time saving to quantify reclaimed clinical hours, and also it can access a granular audit trail of medical codes and clinical notes generated per consultation. Reports are organised into 4 key pages. However, we're just going to look at the overview page. It is a leadership dashboard, and it displays total intellects, audio length and word counts. It features the estimated time saving visual, a top 10 users leaderboard, and also a usage tree summarising total clinical notes, medical codes and letters generated. So again, we do have the additional resources. We've got the Help Centre guides. The telephony reports are in progress, and the Omni consultation report is coming soon. As I mentioned before, the Surgery Intellect report is available. And we also have the Academy modules that will be CPD accredited. So they will be coming soon as well. Okay. So that's it. I hope you found the information and demos useful. In terms of next steps, if you want to learn more, or you could get in contact with your customer success advisor if you've got any more questions or request help with configuration or book some training sessions. Thank you for attending today's webinar. We do have one more webinar in this series, which is next Wednesday, the 27th of May at 10:30. So please pass this on to anybody else who you may think is interested in attending. And then our next webinar series focuses on data to decisions, introducing the enhanced reporting. And that first one being on the Thursday, the 4th of June at 10:30. So look out for the invite. So thank you very much for your time, and it's goodbye from Dee and myself. Thank you very much.